Hey, how's it going today? That's good. Well, my name is Dr. Dylan. I know, kind of rolls off the tongue, doesn't it? And I'm going to be performing a cranial nerve exam on you. Is that okay? Excellent. To start off, can I have you confirm your name and date of birth? Excellent. Always got to make sure I have the right patient. So today we're going to start off, we're going to go around to your cranial nerves and just make sure everything's working good. Make sure you're not having any kind of problems and kind of go from there. How's that sound? Excellent. So to start off, have you noticed any changes to your smell recently? No? Okay. Any troubles at all with your smell? No? Good. Nothing out of the ordinary. Everything seems to be working fine, to the best of your knowledge. Perfect. So to start off, I'm going to test this. I have some candle wax here, and I removed the label on it so you cannot tell what the scent is. So I'm going to have you start off by covering your right nostril, and I want you to get a whiff of that. Okay, and then cover your left nostril. And what smell are you getting from this? Cinnamon, good. Alright, so now I want you to just make sure that we get the cinnamon out of the way. Same thing, gonna start off, cover your left nostril here. I want you to just take a nice deep breath in and out. Any kind of blockage, any kind of trouble with that? No? Okay, excellent. Now cover your right nostril and same thing. Nice deep breath in and out. Any trouble there? No, perfect. So next I'm going to move on to vision. This one's a little bit more in depth, but vision's sort of it's a big one. Not only obviously do we want you to see good, but if there is any kind of complications or trouble with your vision, that could be indicative of something a lot bigger, and it can just have a lot of problems. So starting off, same thing with vision. I'm going to ask, have you noticed any changes to your vision recently? No? Okay. Any troubles at all? You're not any kind of blurry vision? Are you seeing spots in your vision? Anything like that? Any double vision? Perfect. And then do you wear any kind of glasses, contacts, anything like that? No? Okay, perfect. So to start off, I'm going to have you cover your left eye for me. And I'm going to, there's your upper vision and your lower vision, and then obviously on the left and the right. So cover your left eye for me to start off. What I'm going to do is hold up a number, and I want you to repeat that number. So start off up here, down here, okay, up here, and down here. Excellent. And now cover your other eye. Okay. We're going to do this one in reverse. So number, 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 number. Excellent. Any kind of double vision with that? Anywhere in your vision on either eye, any kind of double vision at all? Or any complications with it? No blurriness, anything like that? Excellent. Okay. So next up, I have a little torchlight. I'm going to have you cover your left eye to start off with. And we're going to come over here with the light. I'm going to have you look up for me. And down. Okay. Look to your left. And to your right. Excellent. Okay, and then switch to your other eye. Okay, up. And look down for me. Have you looked to the left? And to the right. Excellent. My flashlight would turn off. Everything seems to be looking good there. And then next up, I'm going to have you cover your left eye again. And I want you to follow the tip of this pen here. So, starting off, just follow the pen. And about middle there. How's that for you? No kind of trouble there? Excellent. Did you feel like at any point that the image was skipping, or do you feel like it was a nice smooth transition as you were looking around the room? Excellent. Excellent. Okay, now I'm going to keep going with this pen here. I'm going to have you cover your left eye for me. And look at the pen. You see the shade of green that it is. Okay. Now cover your right eye for me. And same thing over here. Okay. So the point of that was, I want you to tell me, was there any difference in the green between both eyes? Or does it seem like it was the same type of green? Okay. There wasn't any kind of one eye was darker or lighter than the other? Excellent. Well, that's perfect. All right. So lastly, I'm going to start off, same thing, cover your left eye here. I'm going to start with the pen in the middle here, and I want you to tell me when you can no longer see it. By look straight ahead, do not follow the pen. Okay. Somewhere right around there. Excellent. And the other eye, start off about here. And then somewhere around here as well. That's good. Alright, so next up, I'm going to take this pen here. I'm going to test for your sense of sensation. I want you to put out your palms like that. And I'm either going to touch you with the pointy end of this pen or the dull end of the pen. And I want you to tell me if it feels sharp or if it feels dull. I'm going to start off. Can you feel that at all? What about this over here? Okay. Then this over here. And one more time over here. No troubles there. Excellent. Now I'm going to do a facial muscle test. So I want you to start. I want you to close your eyes as tight as you can. Okay? And then I want you to spring them open as wide as you can. Any troubles there? No trouble blinking? No trouble opening the eyes or closing them? Excellent. Alright. Now I'm going to have you smile as wide as you can. Excellent. And I want you to blow out your cheeks. I know, seems a little goofy, but just checking to make sure all the muscles in your face are working good. Excellent. Alright. So now we're going to move on to your hearing. And we're just going to start off a simple. I'm going to have you close your eyes for me. And I'm going to start off with some numbers. Just want you to tell me what kind of numbers you hear. 99. 84. 72. Did you have any trouble hearing those numbers? Okay, perfect. And then lastly, I'm going to say just a couple random words, no correlation between them, and just tell me what kind of words you hear. Okay? Drain. Eye examination. Pumpkin pie. Lab coat. Smile. Cheesesteak. And any trouble with those? Excellent. Then lastly, I'm going to be checking for your oral health. So any troubles with eating, drinking, anything like that? No. Awesome. I'm going to have you first start off. I want you to sit up as straight as you can and just swallow. If you have water or something nearby, that's fine. But if not, just swallow your saliva and any troubles with that. No, excellent. Okay. Now, same thing. I want you to open as wide as you can, and I'm just going to shine my torch down. The other side. Excellent. And then can you lift your tongue up for me? And tongue down. And then can I have you stick your tongue out? Excellent. Alright. And then lastly, I'm just going to have you say a couple words. They can be as random as you want. Excellent. And then I want you to say your vowels. So A, E, I, O, and U. Excellent. I see in your chart here, the medical assistant already took your vital signs. So your blood pressure, your pulse, everything seems to be looking good. Just reviewing the chart here. Are you currently taking any medications at all? Okay. Well, everything on my end seems to be looking pretty good. If you need to follow up with another specialist, let me know. I can always get you a prior auth and get you in there to see with them if you're having any concerns, but from what I've seen today, everything seems to be looking pretty good. No trouble with vision, smell, taste, anything like that. So I'm going to give you a clean bill of health. I'll see you back in 1 year for another routine physical and kind of go from there. Okay? And please, if anything does change with anything we went over today, any kind of problems or just any changes at all that maybe you don't think they're a problem, but it's definitely an oddball change that you're not used to. Again, it could be indicative that something else is going on, something bigger than you might think. So again, call the office. You can always get another appointment if anything changes, but as of now, everything seems pretty good, and like I said, I don't need to see you back here for another year. Excellent. Well, it was a pleasure meeting you today, and I will see you next time.